Bismillahirrahmanirrahim. Uh, I welcome all the participants in the Zoom meeting on the behalf of University of Sialkot, Rifa University, Sawat Medical College, and Young Doctors Association. Today's our topic is about the policy issues and options for doctors community in current situation. Today we have two speakers, Dr. Mujahid Gilani and Dr. Taha Pasha. So I will from PIMS Islamabad. So I will request Dr. Taha, please continue.
Hello, Assalamu alaikum.
Walaikum
I
assalam.
hope I'm
Doctor, please start.
Assalamu alaikum. Kya haal hai aapke? I hope I'm audible.
Yes.
Okay, so um, let's start by saying Bismillahir Rahmanir Rahim. Uh, Thank you for inviting me to this Zoom meeting regarding the policy and issues that are faced by doctors in COVID-19. First of all, I want to congratulate all the doctors and the healthcare workers that are putting themselves on the front line and going through this crisis right now. I am an intensivist in PIMS Hospital, Islamabad. We are currently dealing with a lot of patients that are coming in with severe COVID 19. My specialty is in intensive care. And at the beginning of this crisis, about 2 months ago, we were dealing with about one or two patients that required intensive care to the extent that they needed to be intubated and kept on mechanical ventilation. Unfortunately, now our beds are full. We have been overwhelmed within 2 months. There are a lot of patients coming in that have moderate to severe COVID 19. When it comes to the policy and the issues that are faced in the current crisis, we can approach this topic in two ways. Uh, One regarding the patient, and one regarding the general policy that is currently being done in the majority of our hospitals. When it comes to PIMS Hospital in particular, the patients that arrive with COVID 19, they are usually presenting with the common symptoms that I'm sure all of you are aware of. That includes cough, it includes shortness of breath, and high grade fever. However, there are cases where a patient of COVID 19 won't present with these typical symptoms. And most of these patients, they do present with these three cardinal symptoms, and they present directly to our isolation center in PIMS, which is a separate area from the hospital. Unfortunately, after an overwhelming amount of patients that are now coming to our main center, they are now presenting in the main emergencies as well. Some of them present with just diarrhea. And I cannot emphasize the importance of the need to protect doctors, healthcare workers from these patients as well, because it takes one patient to enter a main emergency who is spreading the virus, and that one patient can spread it to one or two doctors, and from there it can spread throughout the entire hospital. This has already happened in PIMS, unfortunately. So the policy of keeping a center hospital which is dealing with COVID 19 and opening its doors to the majority of patients that are non COVID is exposing not just the patients themselves, but other patients that are non COVID as well as healthcare workers. So, a general policy that we can discuss and that should be included is the individualization of specific hospitals to fight this disease. When it comes to the spread of the general virus, uh, the more importance should be placed on testing. All patients need to be tested now. There are patients that are going to present in variety of hospitals. They may have symptoms of myocardial infarction, and while they are being tested, for their MI, they may turn out to be COVID positive as well. General hospitals, from my information, in the Islamabad area that are doing elective procedures, especially related to obstetrics and deliveries, they're doing COVID 19 testing via PCR prior to their admission, especially for females that are about to deliver, according to the days a week prior to their admission. They're doing their COVID 19 tests. In the same way, majority of private hospitals are now starting to screen patients that are coming in for elective procedures or elective admissions, and they're doing their COVID 19 tests. When it comes to further policy with regards to intensive care as well as the general admission of patients, I'm just going to break it down in three steps. What we receive on step one are patients that are coming in that are asymptomatic or mildly symptomatic. They are tested and screened for their COVID 19. If they have symptoms to the extent that they are feeling ill, they have severe cough, or they have even slight shortness of breath, we're talking about MRC 1 to 2 or even 3, we admit them in our isolation ward. Any other patient that is mildly symptomatic is sent home as a quarantine, at home, and to await their tests. Tests arrive within 72 hours from National Institute of Health. If it's positive, a team is sent and they assess, is the patient able to quarantine himself at home adequately? Is the quarantine at home enough for the patient and the individuals around him to be isolated and not spread the virus? If by any chance that the family, there are elderly people in the family, or there is not enough room for isolation, they are then shifted to a quarantine center. And there is a constant communication between our isolation team, infectious disease team, NIH, with those patients that are in the general population. Once a patient is symptomatic and admitted to the isolation ward, he goes to the step two. Step two includes um, multiple treatment modalities, the primary of which is high flow oxygen. Usually, patients respond. There is a lot of information coming out about hydroxychloroquine, about chloroquine, about uh, tocilizumab. These modalities are being used currently in PIMS, but over the past 3 months, we have seen that the response is quite broad. A lot of patients respond, a lot of them do not. It varies from patient to patient. Step three is where intensive care comes in when a patient does not maintain his saturation at at high oxygenation levels. Our target is usually 92%. They are then shifted to intensive care, where we treat them with a variety of modalities, the primary of which is invasive ventilation. When it comes to the question regarding these three steps of the quarantine and isolation, it must also be emphasized with regards to the policy making and the government modalities that there are patients, there are people in, especially in Pakistan, that are below the poverty line. They're not even at the poverty line; they are way below. They do not have homes to quarantine themselves in. They do not have isolated rooms to isolate themselves from the rest of their families. And this issue is worldwide. The United Nations are also getting involved with developing countries where we have a large population that are under the line when it comes to having the availability to isolate themselves. And unfortunately, so far, that fear that we have. This will probably lead into our second topic. I think Dr. Mujahid will be more emphasizing regarding the issues faced with doctors. But let me just speak for 2 minutes regarding the psychological, social impact on doctors as well as the population. Because the fear that we have is the fear that we see in Italy and the fear that we see in Iran, and the possibility that they will come, especially now with the current government policies of opening this lockdown. Unfortunately, it's a choice because of the economic crisis that we're going through. Ambulance upon ambulance may start arriving at these major hospitals. And once ambulance upon ambulance starts arriving at the major hospitals, we will be overwhelmed because these patients will be severely symptomatic. Most of them may need step three right away. It hasn't happened so far. We are overwhelmed. There are patients that are coming in, but right now the government has made an emergency policy where hospitals that are overwhelmed will now be started to shift to other private hospitals, and RIPA being one of them. Uh, the rest of the hospitals include Shifa, etc. But this is the greatest issue, the greatest fear that majority of healthcare workers fear, that a point may come where we will have those overwhelming numbers. Secondly, the psychological impact is quite severe when it comes to all doctors, the healthcare workers that are working in the emergency, working even in OPDs that are currently open in some areas. Uh, those that are working in the isolation wards, in intensive care, uh, unlike the earthquake where previously I was present in the major earthquake that happened in Pakistan, the response was incredible. Uh, Doctors from all over Pakistan came in. There were funds coming in. There were people coming in to assist those. There were attendants coming in. There was food available for people that were lying in the street, in the lawns. Pakistan came together. Unfortunately, because of the infectious spread, because of the psychological stress that something bad may happen to people that are exposed, there's a stigma that is now implemented on these patients, and it's not fair to them because this stigma causes the help that could be given to these patients, it is taken away. And people that are wearing uh, protective equipment, personal protective equipment, sorry, they are they are still having this fear. They're still not getting physically involved as much as they should. Currently, the guidelines require a patient to wear a surgical gown or a proper PPE along with goggles and an N95, and that's it. We need to start helping these patients more physically. We need to take care of their oral hygiene as well as their personal hygiene, and we have to get rid of this social stigma. At the same time, the stress, it's present, and because of the overwhelming numbers, there are a lot of people, there are a lot of doctors that are facing something that would be similar to post-traumatic stress disorder. And the CPSP has included a form every time you enter their website, um, with regard to personal questions where they ask you, are you losing sleep? Are you having difficulty dealing with your daily lives? Are you getting angry? Are you crying uncontrollably for no reason at all? And a majority of doctors, whether they admit or not, that are involved in this pandemic, they are going through this. They are, and the psychological impact, hopefully, when Allah takes this burden off of our shoulders, it's going to be present. There will be a lot of doctors, there are a lot of healthcare workers that are going to be anxious, that are going to have anxiety issues, anger issues. And finally, I mean, I just want to say again, uh, a big thank you, and my prayers to all healthcare workers, to Rifa University, to everybody that is involved, that is taking individual steps, that is fighting at every single level against this pandemic. I believe, and I truly, truly believe that if we come together, we have a good policy, that we have people that are willing to volunteer, that are willing to come forward, and the government provides them with the basic needs to protect themselves, I truly believe that Pakistan has the greatest potential to respond to this pandemic. And inshallah, we will succeed because Allah is with us. Thank you.
Thank you so much, Dr. Taha Pasha, for such wonderful prayers. And yes, we wish um, every doctor and every warrior should be safe and sound because we need you and we are nothing without you. Thank you so much. So now I will invite Dr. Mujahid Gilani. He has joined us. Please, Dr. Over to you, please.
Bismillah Rahman Rahim. First of all, I need to know if I'm audible.
Yes.
Excellent. Uh, Thank you. I am really grateful to Rifa International University as well as to all the organizers and the hosts who are actually conducting this meeting, who have actually organized this whole session. And thank you, Dr. Taha Pasha, for an excellent talk. I was able to listen to you, and yes, since we are colleagues, I completely agree with you on many of the aspects, particularly the stress factor as well. So I will try that we don't overlap whatever topics and whatever sections that Dr. Taha has touched. I will be talking on a few different elements to it, and maybe towards the more political aspects of this COVID-19 pandemic. Um, Now, as we see over the past 3 months, this COVID-19 pandemic was dealt with in Pakistan in different provinces with a little different approach, particularly in the rural areas and in Sindh, specifically. As we see in Islamabad, a complete lockdown. To be very truthful, when it was the first or the second week of COVID 19 in Islamabad, the way it was dealt with in the major cities of Punjab as well as the federal capital, it was quite commendable, to be very honest. The kind of lockdown that was enacted did help in reducing the number of patients. This is one of the important things to it. But then, as we see that the lockdown is being softened, the shops or the other mega social centers are being allowed to open up. The people are allowed to meet up somewhere. There are certain social gatherings that are still now being, under under SOPs. Let's say under SOPs they are being allowed, and the people definitely don't follow the SOPs, as we have been seeing in the pictures, in the videos, etc. For the past 3 4 days now, the shopping malls, various shops, and various trade centers as well. And as per my information, a few of the trade centers were sealed just because of this. So this is one important aspect of it, how we are going to deal with this COVID-19 as we proceed forwards, as we proceed further. I will take what Dr. Taha had said about the social response to COVID-19 and how it has become a stigma. It has become a fear factor for the people who don't come and people don't come forward to help those who could have been helped in a better way as compared to maybe what we are doing now. Let's talk a little beyond this point now. Uh, One of the important elements to it is how we are dealing with COVID 19 inside and how we are dealing with it outside. Inside the hospitals, it's totally upon the healthcare workers, it's totally upon the nurses, doctors, and of course the administration as well. How it deals with the COVID 19 infection, how it deals with how it deals with the patients, the number of beds, and the other equipments that are important and necessary to treat the patients. We need to form a perfect policy with regards to that. Any pandemic, any pandemic that is new to all of us, definitely COVID-19 infection is something that I had never seen in my life. Even my seniors may not have seen that in their own life, because it's the first time that we are actually observing this COVID 19 thing. So we don't have a definite policy as regards to COVID 19, but we do have definite policies with regards to the pandemics, with regards to the epidemics. We know how we can actually deal with all these things. So, one thing is formulating a policy within the hospital. As Dr. Taha said, we will be flooded with patients, and we expect that we'll be flooded with patients, and it won't be even beds. Maybe patients will be on the wheelchairs, maybe even in the corridors. But we need to form a proper policy for that. A patient lying in the corridor, a patient sitting in a wheelchair cannot be treated. That patient cannot be actually assessed and properly looked after by any healthcare worker, a doctor or a nurse. So either we need to expand our circle, either we need to expand our the facilities that we have, Either we need to expand our domains, just like the government has actually designated Rifa Hospital for this, has designated other hospitals for it as well, and particularly those hospitals that are equipped with the ventilators and the associated equipments that are required with a ventilator. We need to properly equip them, not only with the machines, but also with the workforce as well. This is a policy that needs to be formed, and this is also the issue that we are facing. The already designated hospitals with a very meager workforce, with a very little of the yeah, paramedical staff, that they're facing problems of actually taking good care of the patient, a care that we would actually say that yes, I'm satisfied, I've seen the patient, and I'm done with it. uh, the problem is that once we are flooded with the patients and we do not have a proper policy of referral, we do not have a proper policy of admission, we will not be able to cater for a large number of patients, and eventually the healthcare system is going to collapse. That is one of the problems that we will be facing, and that is where we actually need to form a policy. This is within the hospital. Let's go outside the hospital. Outside the hospital, as we have seen, the district administration particularly had everywhere, everywhere, not only in Islamabad, had enacted a strict lockdown before, and then they softened it up. And ultimately, now as we see, the people are actually going out, the roads are busy, the marketplaces are busy as well. But as we see it, if the number shoots up, and it's not if, it's actually when the number shoots up, and the number of deaths and the number of critical patients increases, we believe that the government may be forced to again impose a strict lockdown. And that strict lockdown will definitely create problems for a number of people. For most of the people that, as Dr. Taha had mentioned as well, are not able to make their daily livelihoods. See, that's a problem. The problem goes beyond that. The problem goes as in that when you're not able to feed yourself and your family for one day, and then you are not able to see a light at the end of the tunnel, and you get to know that, oh, the strict lockdown has been imposed, and probably it's going to be for a month or so, or even beyond that, and my family will die just because of starvation. The person actually goes without reasoning. The person, the family, the bread earner would consider, okay, I can steal for it, I can kill for it, and that's how I should do it. Because the government is not taking care of me, the people are not taking care of me, and it's under the garb of some COVID 19 coronavirus that had never been there. Not even my parents had heard of it, not even my ancestors had heard of it. So, this is basically a garb, some kind of 5G or some kind of an international warfare that's going on, and it will kill my family. This is the reasoning that's going to happen in that person's mind, and he's actually going for the criminal or the crime execution part of it. So that is where the government, that is where the administration has to take its part and has to play its part, and it's beyond any stigma, it's beyond anything. If doctors can risk their lives, if the healthcare workers can risk their lives, the second and the most important element has to be played by the government in actually providing the rations, in actually making sure that whatever policy, whatever grants that the government has sanctioned reaches the actual people. It should not happen that the probably the 12,000 rupees, 12,000 rupees or something that have been sanctioned by the government reaches into the pocket of somebody who already earns 1,20,000 a month. This is one of the important things, the policy that has to be made outside the hospital, and it has to be made outside the hospital from right now. At this point in time, if we have crossed 30,000 patients, we probably will be jumping off to around 100,000 or more, to be very honest about it. This is one of the important aspects of the policy and the inside and the outside element to it. The second thing that we have is how to deal with the people, the workforce, the army that you have at this point in time. Like, for example, if working at the biggest hospital of the federal capital, uh, what I see is that we have a very small workforce, particularly in the more critical areas, in the more critical care department. So, how are we going to deal with it? It's been almost 3 months, and those people working in the critical care department have not had any offs. They have not gone into the quarantines, into isolations, or and they're daily being exposed to this COVID-19 patients, the positive patients, and those patients are on ventilator. So the more important thing is for us, as Dr. Taha said, and I completely agree with that part, is the stress and the depression that we are actually falling in. So this is one part of it. Going beyond it and taking it further, the stress and the depression actually is going to cloud our judgments and the judgments and the treatment options that we have. And I will give you a tiny example of it. Like, for example, there is a particular drug that is administered to the patients of COVID 19 these days on trial basis. But that drug is not only costly, it may have some effects as well, positive effects. And you need to know how many doses have been administered. On a very small element to it, we tend to forget that, oh, this patient was administered 2 doses, or it was the third dose. It was second dose or the third dose. This is a confusion, a very small, a very tiny kind of an example for this kind of a stress that we are facing. We tend to forget things, but it doesn't mean that we aren't going to, the major aspects of it are always being covered. The thing, the way we treat the patients, the way we actually try to manage each and everything and micromanage the things. But we at this point in time need some stress relievers as well, something that will take us out of the depression. Even in the most developed countries, the ratio of deaths for patients who are being placed on ventilator is above 80 or 90%. We doctors don't, yeah, everybody says that we are accustomed to, it's a routine thing to see a person dying for us. Well, it's not, that's not the fact, because we are humans as well. And trust me, I have the way I remember a patient of mine died recently. And मैंने उसके सर पे हाथ फेरा था, मतलब I could actually tell that he was an elderly person, and I told him that I'm just sorry. I'm sorry, I couldn't do anything. See, the thing is that we want to save them. We want to save each and every patient of ours, but somehow, somewhere, we are not able to do that. And it's just not an add-on to our lives. Okay, मर गया patient. No, it's an add-on to our depression. It's an add-on to something that we don't want. And whenever there is a pile of something that we don't want, that actually creates a lot of problems. That will cloud our judgments. We need workforce along with the equipments, along with the other things that will facilitate us in treating the patients. So whenever we are asking for PPEs, whenever we are asking for equipments, whenever we are asking for associated equipments, it's not something that we are playing at. It's actually that we demand to save the lives of our patients. Okay, the other thing that I want to talk about beyond these things is the options that we have at this point in time. The options, one, subject specific for the treatment of it, for the treatment of COVID 19 infection. And number two, the options on how to manage and tackle this whole problem, both within the hospital and outside the hospital. See, now the treatment options that we have for COVID 19 are not really clear. There is no specific drug of choice, as we say, for particular this COVID 19. We have been giving trials of certain medications, certain drugs, IV drugs as well. We have been using plasma, convalescent plasma as well. But till now, it's not. There is no specific drug that will just treat our patients and will be at the end of the day having a happy dance over it. It doesn't work like that. So we are trying. We are trying with different theories that we have coming over from all over the world. be it that this is a COVID ARDS, be it that this is a problem of oxygenation and hemoglobin or ferritin or something like that, be it that we have a problem with not only the lungs, it's also the heart, it's the kidneys and the blood pressure and the circulatory system uh, that is harmed by the COVID-19 infection. Yes, we are trying on all fronts. But once again, as Dr. Taha had said as well, we're a government hospital at PIMS, we are at a government hospital at a polyclinic or other government hospitals in Rawalpindi and the adjoining areas of the federal capital. We will be flooded with patients. And as you're flooded with patients, you're more concerned with actually treating the patient as compared to the documentation of it, as compared to going for a research part of it. So this thing is more important for universities, just like RIFA is there, for example, for once. RIFA in collaboration with the government hospital and your research scholars being physically present over there along with us, working with us, that can help. We need to document these things. We need to conduct a research at this point in time and get something out of it so that we can actually benefit our patients. We can actually get to say that we are doing a proper treatment that is completely designated, that is completely specific for COVID 19. At this point in time, as is the policy, the principle, and the standard worldwide, we are treating the organ failure. We're going for the organ failure support. So this is one thing, the options in the treatment, the subject specific element. And the next thing is the management of it, the management of COVID-19 infection. Uh, we at this point in time are a small workforce, true, but then we need volunteers. We need people who know the things. But because of the lockdown or because of whatever they were doing, whatever their occupation, their jobs were, uh, they're not doing it these days just because of the lockdown, the quarantine, whatever it is. They're sitting at home, and we need these people. These people are actually our what do you call as the reserve force, and we need them. But will a person who is in a reserve force come to the hospital and work with us in an extremely known hostile in the sense of infection, the COVID-19 infection environment? One, and number two, will that person come over without any guarantees? Look, we have people who are working with us as volunteers. They know that it's a perfect environment to catch a COVID-19 infection. They also know that they're not going to be paid for it. And yes, at the end of the day, probably we'll be thanking them. Thank you. You did a good work. Allah Hafiz. That's it. But see, that's the problem. For a bigger workforce, for a bigger thing, we need to have people. We need to have people who have some incentive so that we can actually sustain them, continue along with them. It's like we don't expect the COVID 19 infection to go off in a jiffy. On the 18th of June, there will be no COVID 19. It doesn't work like that. We expect the COVID 19 to extend and to be more likely beyond the months. So we need to have a sustainable workforce. The government needs to work on it. The ministry needs to work on it. I don't know whoever, but they need to work on it on a sustainable aspect. This COVID 19 may extend beyond 6 months, and we need to have people in the workforce who can actually then work or replace the already working workforce over here. The other management part of it is how we are going to deal with this life now. This is the COVID 19 life. You're wearing masks, you cannot go for a handshake, and you don't hug people. Those were the norms of our social life, but we don't do that anymore. We don't get to we doctors particularly or the healthcare workers come back to our homes, and we don't specifically with our parents. We don't go for a handshake. We don't go for a hug. Or as we say,
أعوذ بالله من الشيطان الرجيم.
and everybody would understand as a human and the same emotional part of it. We need that. Everybody needs that. In our social circle, we do because that is how we have been living. But now the life has changed, and that changed life. This kind of precision that we are holding online. me sitting at the workplace, Dr. Taha sitting at the workplace. Uh, this is how it's going to be the normal life now. And we need to infuse and teach our people, our nation, that this is the life. This is the COVID 19 life. Wearing a mask, wearing gloves, observing social distance. This is how it has to be. And this has to be infused in people so that they accept it. This is where you have to manage the things. You don't let a wagon wala take in 22 people in his wagon
أعوذ
to Lahore.
بالله من الشيطان
15 people
الرجيم
in his wagon. 22 people will be sitting jammed in. We don't have the airport facilities, the airplanes taking off to London or to any other city the way they used to before. This has to be infused. Something has to be told to people that this is how it's going to be. There will not be any evening samosa and chai wala where a hub of people will be sitting together and talking about stuff. It doesn't work like that anymore. See, this is the management that has to be done. This management has to be infused among people. This management,
أعوذ
this new life
بالله
has
من
to be infused
الشيطان
and then come out for us.
الرجيم
Lest the
بسم
problem again
الله
will be that the healthcare system will collapse. So these are a few
الرحمن
things that I wanted to talk about. The options that
الرحيم
we have in this
الله
country,
لا
especially
إله
in
إلا
terms of
هو
being managed
الحي
and people have nothing to live without. The
القيوم
policies that we
لا
need to enact,
تأخذه سنة
doctors that we have, we need to
ولا
engage with them and we need to
نوم
enact it
له
properly.
ما في
So these are the
السماوات
things that I
وما
wanted
في
to
الأرض من
actually be on it. Thank you once again to everybody, particularly to the organizer and the host, and thank you, Dr. Taha Pasha, for joining this session and your valuable suggestions.
Thank you so much, Dr. Mujahid Gilani. If anyone has a question, okay, no one. Now I will request Dr. Muhammad Adnan Kurban to say something about these sessions, and then we will go for the concluding remarks from Professor Dr. Aziz Ahmad as well. Dr. Muhammad Adnan Kurban, we need your comments, please.
अस्सलाम वालेकुम जी।
Walaikum Assalam.
डॉक्टर ताहा पाशा और डॉक्टर मुजाहिद गिलानी साहब ने काफ़ी अच्छा माशाल्लाह एक्सप्लेन किया, और जो ये दोनों लोग हमारे फ्रंट लाइन वॉरियर्स में से हैं, जो इंटेंसिव केयर यूनिट में मोस्ट सीरियस पेशेंट कोविड-19 से अफेक्ट होते हैं, उनको देखते हैं। तो जिस तरह उन्होंने सारी इन्फॉर्म भी किया कि जिस तरह वक़्त गुज़र रहा है, उसी तरह हम इससे ज़्यादा ट्रबल में भी जा रहे हैं, और चीज़ों को मैनेज करने में हमारे पास रिसोर्सेज़ भी इनएडिक्वेट होते जा रहे हैं। डेफ़िनिटली उनका फ़ोकस यही था कि लोग सारी जो गाइडलाइंस हैं उनको फ़ॉलो करें और प्रिवेंशन के ऊपर काम करें। जिस तरह के दुनिया में पाकिस्तान तो ख़ैर एशिया के लोग ममालिक इतने ज़्यादा अफ़ेक्ट नहीं हुए जितने कि यूरोपियन कंट्री या अमेरिका अफ़ेक्ट हुआ। जिस तरह के कुछ इसमें कॉन्स्पिरेसीज़ भी हैं कि उन लोगों को जो उनकी आर्मी में या उनकी नेशन को वैक्सीनेशन की जाती थी नॉर्मल इन्फ्लुएंजा वायरस की, क्योंकि ये वायरस भी बेसिकली उसी फैमिली में लैंड करता है जो इन्फ्लुएंजा वायरस है, सार्स और कोविड-19। जिस तरह सार्स को उसको कोविड-2 भी उसके साथ भी इसका आरएनए मटेरियल, जेनेटिक मटेरियल मैच करता है। तो उन लोगों को ज़्यादा ऑलरेडी उनके बॉडी में भी इसकी स्ट्रेन्स मौजूद थे, जिसकी वजह से ये स्टिमुलेट हुए या उनकी इम्यूनिटी का इफ़ेक्ट था। देयर आर अ लॉट ऑफ थिंग्स। लेकिन अल्हम्दुलिल्लाह हमारे जो फ्रंट लाइन वॉरियर्स हैं, डॉक्टर्स हैं या हमारी गवर्नमेंट की पॉलिसीज़ हैं, बहुत अच्छा कंट्रोल किया। लेकिन अभी भी बहुत ज़्यादा काम करने की ज़रूरत है, जिस तरह अभी कुछ स्पेशलिस्ट हैं, इसकी अभी डेफ़िनेट मैनेजमेंट तो नहीं है, लेकिन डॉक्टर रऊफ़ नियाज़ी एक पिम्स के बड़े मशहूर डॉक्टर हैं। उन्होंने इसको कहा कि जी अगर आप 200 एमजी या 400 एमजी और इवन 200 एमजी हाइड्रोक्सी क्लोरोक्वीन या प्लेकिन एच या ऑक्सीक्लोर अगर 3 वीक्स भी आप एक गोली भी इस्तेमाल कर लें, تو وہ آپ کو 22 ڈیز کے لیے پلازما میں وہ میڈیسن رہتی ہے پروفیلیکٹیکلی اور انف لنگ ٹیشو کنسنٹریشن پرووائڈ کرتی ہے ٹو کمپیٹ ود کووڈ-19. اگر ہمارا بلڈ یا جو جس میں ہمارے سائنس کنسنٹریشن اگر سفیشینٹ نہیں بھی ہے تو یہ ہماری لوور ریسپیریٹری ٹریکٹ انفیکشن یا ڈیڈلی انفیکشن کو ہیلپ کرتی ہے کنورٹ کرنے ان اپر ریسپیریٹری انٹو اپر ریسپیریٹری ٹریکٹ انفیکشن. تو جس طرح کیونکہ ہم اپنے ڈاکٹرز کا برڈن کو کم کرنا چاہیے, یہ پازیٹیو میسج کے ساتھ آگے جانا چاہیے. جس طرح لوگ کہتے ہیں نا کہ مشہور سینگ ہے کہ ہر چیز کا علاج مل جاتا ہے, وہم کا علاج نہیں ملتا. تو ہمیں وہم میں نہیں جانا چاہیے اور ڈاکٹرز کا کام ڈاکٹرز پہ چھوڑنا چاہیے. لوگوں کو اپنی طرف سے ٹریٹمنٹ ڈفرینٹ طرح کے ٹوٹکے یہ وہ اس کو مذاق نہیں سمجھنا چاہیے. تو جو ایک ہیلتھ پروفیشنلز کی ریسرچ میں یا ان کی اپنے نالج کے اکارڈنگ بات ہے ان کو فالو کریں. ہمیں زیادہ آئی تھنک پریونشن کے اوپر ابھی بھی کام کرنے کی ضرورت ہے کہ ابھی بھی ہماری پاپولیشن اتنی
أعوذ
افیکٹڈ نہیں ہے جتنی
بالله
دنیا کے
من
لوگ افیکٹ ہوئے یا اسٹریس میں
الشيطان
گئے, پریشان ہوئے. میں ایک اور بات بھی ایڈ کرنا چاہوں
الرجيم.
گا کہ ہمیں فزیکل ڈسٹینس کے اوپر فوکس رہنا چاہیے ایز کمپیئر ٹو سوشل ڈسٹینسنگ, کیونکہ ہمارے بہت سے لوگ بہت غریب ہیں جن کے ہمیں بہت خیال رکھنے کی ضرورت ہے. ان کے چھوٹے چھوٹے کاروبار ہیں, جس طرح گورنمنٹ نے ایس او پیز بنا کے ان کو شروع کرنے کی اجازت دی ہے. کہ الٹیمیٹلی ہم زیادہ دیر اس کے ساتھ گھروں میں بیٹھ کے رہ نہیں سکتے, کیونکہ اس کے ساتھ رہنا سیکھنا ہوگا. جس طرح آلریڈی ڈاکٹرز جانتے ہیں کہ بہت زیادہ انفیکشن موجود ہیں. جس طرح کہ اگر کہا جائے کہ جی دھوپ سے اسکن کینسر ہونے کا رسک ہوتا ہے تو لوگ دھوپ میں نہ نکلیں, اور جی زہر ایتھروسکلیروسس لپڈس کھانے سے یا چکنائی میں کھانا بنانے سے ہائپر ٹینشن بلڈ پریشر ہونے کا خطرہ ہے. تو اس لیے یہ ہے کہ ہم لوگ کھانا ظاہر اس میں بالکل ہی نہ بنائیں, لیکن بیسک ضرورت ہے کہ ہمیں اس میں بنانا پڑتا ہے. اس لیے ہر چیز کو ایک مناسب طریقے سے اعتدال میں رہ کے اگر استعمال کیا جائے یا چیزوں کو لیا جائے, جس طرح بھی اگر گورنمنٹ ایک پالیسی دیتی ہے کہ لوگ اپنا کس طرح بزنس کر سکتے ہیں, تو لوگوں کو وہ ساری انسٹرکشنز کو فالو کر کے اس کے ساتھ رہنا سیکھنا چاہیے. تو میں بہت شکر گزار ہوں ڈاکٹر مجاہد گیلانی صاحب کا, ڈاکٹر طاہر پاشا کا, جنہوں نے اپنا ایکسپیرینس شیئر کیا, اور وہ ماشاءاللہ اللہ تعالیٰ ان کو صحت سلامتی دے. اور آگے بھی سارے ڈاکٹرز یا جتنے لوگ بھی اسے ایون سارے لوگ, ساری ہیومینٹی اس وقت افیکٹڈ, صرف ڈاکٹرز نہیں, سارے لوگوں کے اوپر ہی ریسپانسبلٹی آتی ہے کہ اپنا اپنا فرض نبھائیں, اور تاکہ یہ کولیپس نہ ہو, ہمارا ہیلتھ سسٹم یا ہمیں ہیلتھ ایمرجنسی کی طرف نہ جانا پڑے. تو باقی دنیا میں کانسپریسیز ہیں, جس طرح ہم کہتے ہیں آٹا چینی اس کی مافیاز موجود ہیں, آئی پی پیز موجود ہیں, اسی طرح ڈرگ مافیاز بھی موجود ہیں کہ جو بہت سی حقائق کو بھی چھپائیں گے, اور چیزوں کو جو چیزیں جو فائن ہو جائیں گی, کمپریہنسو ہو جائیں گی, ان کو نہیں آنے دیں گے کہ جی نہیں یہ ایسا نہ کام کریں, ایسا نہ. جس طرح کہ میں تھوڑا سا ایک آپ سے شیئر کرتا جاؤں, جب یہ HIV انفیکشن آئی, اس سے 2 سال پہلے جب یہ پوری دنیا میں اتنی الارمنگ سچویشن میں لوگ افریقہ کے افیکٹ ہوئے, مرنا شروع ہو گئے, اس سے پہلے وہ اس پہ بہت کام کر چکے تھے, جس کے اوپر وہ ان کا ڈیٹا پبلک نہیں ہونے دیا کہ لوگ اس سے اویئر ہو جائیں گے, تاکہ دنیا میں وبا اور خوف پھیلے گا, اس کے بعد میڈیسن جو ہے وہ لانچ کی جائے گی اور اس کو لوگ زیادہ پرچیز کریں گے. میں اللہ تعالیٰ کا بہت شکر گزار ہوں اس معاملے میں کہ یہ انفیکشن بہت تیزی سے پھیلی بھی ہے, لیکن لوگ بہت جلدی سے الحمدللہ ٹھیک بھی ہوئے ہیں, اور اس کا بہت اچھا کیور ریٹ بھی ہے. جس طرح ملیریا تھا یا کوئی پلیگ تھا, جس میں ہر بندہ جس کی کوئی اس میں تعلق نہیں تھا کہ وہ بلڈ پریشر کا مریض ہو یا شوگر کا مریض ہو یا اس کو کوئی اور کوموربڈ کنڈیشنز ہوں, وہ ساری دنیا کے لوگ, بچے بوڑھے عورتیں, ایکول افیکٹ ہوتے تھے ایسی پینڈیمک سے. تو اللہ تعالیٰ کا شکر ہے, اس کے بارے میں بڑی اویئرنیس ہے, ڈاکٹرز نے بہت پازیٹیو ریسپانس دیا, بہت اچھے طریقے سے ماشاءاللہ مینیج کر رہے ہیں. تو میں اپنی ٹاک کو یہاں پہ ختم کروں گا کہ ہمیں اپنی پازیٹیو چیزوں کو آگے پھیلانا چاہیے, نیگیٹو چیزوں کو کنڈیم کرنا چاہیے. جو خوفناک ویڈیوز پھیلائی جاتی ہیں, کسی کو اگر کوئی اور ریسپیریٹری ٹریکٹ انفیکشن ہے سیویئر, جیسا دمہ وغیرہ, تو کھانسی لے رہا تو اس کی ویڈیو پھیلا کے خوف سے لوگ زیادہ پریشان ہیں, ڈپریشن, اینزائٹی. ایون کہ جس طرح کراچی کے ڈاکٹر کی بات بھی ہے, جب اس کو ظاہر ہے وہ ڈاکٹر ہونے کے باوجود اس کو اتنا فیئر تھا کہ جی مجھے اگر وہ نہیں دیے جاتے سارے ٹولز تو میں اپنی فیملی کو انفیکٹ کر دوں گا, تو اس نے سوسائڈ کمٹ کر لی. اس لیے پلیز برائے مہربانی جنرل پبلک کے لیے بھی یہ میسج ہے کہ وہ ڈاکٹرز کی انسٹرکشنز کو فالو کریں, ان کی بات کو سنیں, اور جو ہیلتھ پروفیشنلز ہیں انہی کے اوپر فوکس رہیں. ٹوٹ کے دائیں بائیں کی باتیں جو میڈیا اینکر جو ٹریٹ کر رہے ہیں کووڈ کو, یا پولیٹیشینز کر رہے ہیں, برائے مہربانی ان کی باتوں سے احتراز کیا جائے. تھینک یو ویری مچ.
Thank you, Dr. Muhammad Adnan Qurban, for your valuable suggestions. Now I will request Professor Dr. Aziz Ahmad from Sawat Medical College. Sir, for the concluding remarks, sir, please.
Thanks very much, Dr. Lakshmana. A very interesting discussion, very useful, very informative. I'm sorry I missed some earlier part. थोड़ा मैं busy रहा official work में, लेकिन I really enjoyed it. और मैं ये कहूँगा कि I have nothing to add. In fact, all the facts and figures वो बड़े अच्छे तरीके से हमारे स्पीकर साहिबान ने डिस्कस की, सामने लाई। और परेशानी की बात यही है कि शुरू में हमने इसको लाइट लिया, शुरू में इसको सीरियस लिया गया, सीरियस लॉकडाउन भी किया गया, लेकिन प्रोबेबली दैट वाज प्रीमेच्योर। उस वक्त अभी इन्फेक्शन आया भी नहीं था, हमने सीरियस लॉकडाउन किया, और जब इन्फेक्शन आ गया तो हमने लॉकडाउन रिलैक्स करना शुरू कर दिया। तो बहरहाल गवर्नमेंट की अपनी पॉलिसीज होती है, एंड दे seldom take the stakeholders on board कि एक्सपर्ट से ओपिनियन ले लें और प्रॉपरली इन चीजों को इम्प्लीमेंट करें। तो हमारे थर्ड वर्ल्ड कंट्रीज में ये एक इशू है। तो इन द लॉन्ग टर्म्स वी आर गोइंग टू लर्न अ लॉट फ्रॉम दीज हैपनिंग्स। जो कुछ भी हुआ, तो ये चीजें सामने आ रही हैं कि कहाँ कहाँ पे हैं गैप्स, तो इन गैप्स को फिलअप करना है। और यूनिवर्सिटी ऑफ सियालकोट इस किस्म के जो डिफरेंट इवेंट्स करा रही हैं और ये डिफरेंट इश्यूज सामने आ रही हैं, तो दिस इज एन एफर्ट कि इन गैप्स को आइडेंटिफाई किया जाता है और इसके लिए डिफरेंट लेवल पे काम किया जाता है। तो आई थिंक इट्स क्वाइट यूजफुल। इट वाज Hello. Can you hear me, Dr. Rashadna? That's all I had to say. Thank you very much. Back to you, please.
Thank you so much, sir. I thank you again, Dr. Taha Pasha and Dr. Mujahid Gilani, for joining us for this session. And yes, of course, I will thanks to Dr. Muhammad Adnan Kurban. He always facilitated me and to organize this session. So, Dr. Muhammad Adnan Kurban, thank you so much. I thank you, Rifa University, Sawat Medical College, for organizing all these sessions for the doctors. For the doctors, a lot of prayers, and for all the warriors, front line warriors, stay safe, stay happy, and stay blessed. And thank you so much on the behalf of University of Sialkot, Rifa University, IRP, and Sawat Medical College. And I thanks again to Young Doctors Association for joining this session. Thank you so much. And we will have different sessions with doctors, inshallah, on different issues. So thank you so much again. Stay safe and stay happy. Allah Hafiz.